Imagine Sarah, noticing her father, once a vibrant handyman, struggling with simple tasks like screwing in a light bulb. Or perhaps John, a keen cook, finds his sense of smell diminishing, unable to fully appreciate the aromas of his favorite dishes. These seemingly insignificant changes could be early whispers of Parkinson's disease, a progressive neurological disorder affecting movement and more. Parkinson's disease, at its core, involves the loss of dopamine-producing neurons in the brain. Dopamine is crucial for smooth, coordinated movements. Recognizing the early signs is paramount. While there's currently no cure, early diagnosis allows for timely intervention, symptom management, and a better quality of life. This isn't about instilling fear, but empowering you with knowledge. Spotting these subtle clues early can make all the difference in navigating the challenges that Parkinson's may bring. Let's delve into the signs you shouldn't ignore. Let's begin with one of the most recognizable yet often misunderstood signs: tremor. Not all tremors indicate Parkinson's, but the specific type associated with the disease is crucial to recognize. Imagine a slight, rhythmic shaking in the hand, even when the hand is at rest. This is often described as a resting tremor. A characteristic movement is the pill-rolling tremor, where the thumb and forefinger appear to rub together as if rolling a pill. This tremor typically starts on one side of the body and may eventually spread to the other. It's important to note that essential tremor, a more common condition, usually occurs during action, such as when holding a cup. If you observe a tremor that primarily occurs at rest, consult a medical professional for proper evaluation. Differentiating between tremor types is the first step toward accurate diagnosis. Beyond tremors, another key indicator is bradykinesia, or slowness of movement. Imagine struggling to button your shirt in the morning, a task that once felt effortless. Or picture walking with a noticeably shorter stride, your arms barely swinging. These subtle changes can be manifestations of bradykinesia. It's not just about moving slowly, it's about difficulty initiating movement and a general reduction in spontaneity. Everyday tasks that require dexterity, like writing or using utensils, may become increasingly challenging. This slowness can be frustrating, impacting independence and quality of life. While aging can naturally slow us down, bradykinesia associated with Parkinson's is distinct. It's a pervasive slowness that affects multiple aspects of movement and often accompanies other symptoms. If you observe a persistent and unexplained slowness in your movements, it's crucial to discuss it with your doctor. Adding to the challenges of bradykinesia is rigidity or stiffness of the muscles. Imagine trying to bend someone's arm and feeling resistance throughout the entire range of motion. This is akin to rigidity. In Parkinson's, this stiffness isn't just occasional soreness. It's a persistent resistance to passive movement. There are different types of rigidity. Cogwheel rigidity feels like ratcheting or jerky movements when a limb is moved passively. Lead pipe rigidity, on the other hand, is a constant, uniform resistance. A doctor may assess rigidity during a neurological exam by gently moving your limbs and feeling for this resistance. This stiffness can contribute to pain, fatigue, and decreased range of motion, further impacting daily activities. While muscle soreness from exercise is common, persistent, unexplained rigidity should be evaluated by a medical professional to rule out underlying causes. Postural instability or impaired balance is another significant sign. Imagine feeling unsteady on your feet, particularly when changing direction or standing after sitting. This instability increases the risk of falls, a serious concern for overall health and well-being. While postural instability often emerges later in the progression of Parkinson's, it can sometimes be an early indicator, especially when coupled with other symptoms. The brain's ability to maintain balance relies on a complex interplay of sensory information and motor control, both of which can be affected by Parkinson's. Simple tasks like walking across a room or navigating uneven surfaces may become challenging. If you find yourself frequently losing your balance or experiencing near falls, it's important to consult a healthcare professional to determine the underlying cause and explore strategies for fall prevention. Now, let's turn our attention to a less obvious, yet surprisingly common, early sign: loss of smell, also known as anosmia. Imagine no longer being able to detect the fragrant aroma of your morning coffee or the sweet scent of blooming flowers. This seemingly minor change can actually be an early warning sign of Parkinson's, sometimes preceding motor symptoms by years. The olfactory bulb, responsible for processing smells, is one of the first areas in the brain affected by the disease process. It's important to distinguish this from temporary smell loss due to a cold, allergies, or sinus infection. If your sense of smell has diminished significantly and persistently, without an apparent cause, it warrants investigation. While not everyone with anosmia will develop Parkinson's, it's a factor that doctors consider, especially when combined with other potential symptoms. Shifting our focus, let's explore the realm of sleep disturbances. Parkinson's can disrupt sleep in various ways. One notable example is REM sleep behavior disorder, RBD. Imagine someone acting out their dreams, yelling, punching, or kicking while asleep. This occurs because, normally, our bodies are paralyzed during REM sleep, preventing us from physically acting out our dreams. In RBD, this paralysis is absent. Insomnia is another common sleep problem. Difficulty falling asleep or staying asleep can significantly impact daytime functioning and overall well-being. These sleep disturbances aren't merely a nuisance. They may reflect underlying changes in the brain related to Parkinson's. Research suggests a connection between these sleep disorders and the neurodegenerative processes associated with the disease. If you or a loved one experiences these types of sleep disturbances, particularly RBD, it's important to discuss them with a doctor, as they can be early indicators of Parkinson's or other neurological conditions. Let's consider an often overlooked symptom. Constipation. It might seem unrelated, but persistent constipation can be an early indicator of Parkinson's, sometimes appearing years before motor symptoms become evident. The connection lies in the gut-brain axis, the complex communication network between the digestive system and the brain. Parkinson's can affect the autonomic nervous system, which controls involuntary functions like digestion. This disruption can lead to slowed bowel movements and constipation. While occasional constipation is common, chronic constipation, not easily relieved by dietary changes or over-the-counter remedies, should raise a red flag. The gut microbiome is also being increasingly studied for its role in Parkinson's development. While discussing bowel habits may feel uncomfortable, it's essential to inform your doctor about persistent constipation, especially if you're experiencing other potential symptoms. Another subtle sign lies in changes to the voice. Hypophonia, or a soft voice, is common in Parkinson's. Imagine struggling to project your voice, even in a quiet room. Your voice might sound quieter, more monotone, or even hoarse. Others may comment that they have difficulty hearing you. These changes occur because Parkinson's affects the muscles that control speech. The vocal cords may not vibrate as strongly, and the diaphragm muscles, essential for breath support, can weaken. While a cold or laryngitis can temporarily affect your voice, persistent voice changes without an obvious cause should be investigated. Speech therapy can be incredibly beneficial in managing hypophonia. A speech therapist can teach exercises to strengthen vocal muscles, improve breath control, and increase vocal projection, helping you communicate more effectively. Another subtle change can occur in facial expression. A masked face, or hypomimia. Imagine someone who always seems to have a neutral or blank expression, regardless of their mood. They may have difficulty smiling, frowning, or conveying emotions through their face. This reduced facial expressiveness is due to the same muscle rigidity and bradykinesia that affect other parts of the body. The muscles in the face become less responsive, making it harder to form expressions. This can impact social interactions, as others may misinterpret the person's lack of expression as disinterest or aloofness. It's important to distinguish hypomimia from simply being a person of few outward emotions. Hypomimia is a noticeable reduction in facial expression compared to the person's usual demeanor. If you observe a significant change in someone's ability to express emotions through their face, it's worth investigating further. Micrographia, or abnormally small handwriting, is another subtle motor symptom that can be an early clue. Imagine noticing that your handwriting has become increasingly cramped and difficult to read. Letters may be smaller than usual and words may be crowded together. This occurs due to the bradykinesia and rigidity affecting the small muscles in the hand and fingers. What was once a fluid and effortless task becomes a struggle. You might notice that your signature has changed significantly or that you can no longer write comfortably for extended periods. While changes in handwriting can also be attributed to arthritis or other conditions, micrographia associated with Parkinson's is often progressive and accompanied by other motor symptoms. Keeping examples of your handwriting over time can be helpful in tracking any changes and discussing them with your doctor. Beyond the physical symptoms, it's crucial to acknowledge the emotional and psychological impact of Parkinson's. Mood changes, such as depression and anxiety, are common and can sometimes be early manifestations of the disease. These aren't simply reactions to the physical challenges. They can be directly related to the changes occurring in the brain. Imagine feeling persistently sad, hopeless, or losing interest in activities you once enjoyed. Anxiety can manifest as excessive worry, restlessness, or panic attacks. These mood changes can be debilitating and significantly impact quality of life. It's important to remember that depression and anxiety in Parkinson's are often linked to changes in brain chemistry, specifically affecting neurotransmitters like serotonin and dopamine. Seeking treatment for these mood changes is essential, as effective therapies are available, including medication and counseling. Addressing these emotional symptoms can significantly improve overall well-being. It's crucial to reiterate, experiencing one or more of these symptoms doesn't automatically mean you have Parkinson's. Many of these symptoms can be caused by other conditions. However, if you're concerned, it's vital to consult a doctor, preferably a neurologist or a movement disorder specialist. A neurologist will conduct a thorough neurological exam, assessing motor skills, balance, coordination, and reflexes. They may also order imaging tests, such as an MRI or DOT scan, to help rule out other conditions and assess dopamine activity in the brain. Diagnostic process is comprehensive and aims to identify the underlying cause of your symptoms. Early diagnosis provides the opportunity to begin treatment and manage the disease effectively, improving your quality of life and slowing down its progression. Don't hesitate to seek medical advice if you have concerns. While there's no cure for Parkinson's, numerous treatments are available to manage symptoms and improve quality of life. Medications, such as levodopa, help replenish dopamine levels in the brain, alleviating motor symptoms like tremor, rigidity, and bradykinesia. Other medications can address non-motor symptoms like depression and sleep disturbances. Therapies, such as physical therapy, occupational therapy, and speech therapy, play a crucial role in maintaining function and independence. Physical therapy can improve balance, coordination, and mobility, while occupational therapy focuses on adapting daily activities to make them easier to manage. Speech therapy addresses voice and swallowing problems. Lifestyle changes, including regular exercise, a healthy diet, and stress management techniques, can also significantly impact well-being. A multidisciplinary approach, involving doctors, therapists, and support groups, is essential for comprehensive care. The field of Parkinson's research is dynamic and filled with hope. Scientists worldwide are working tirelessly to understand the underlying causes of the disease, develop more effective treatments, and ultimately find a cure. Research is focusing on areas like genetics, neuroprotection, and regenerative medicine. Clinical trials are constantly underway, testing new medications and therapies. You can find information about ongoing research and clinical trials through organizations like the Parkinson's Foundation and the Michael J. Fox Foundation. Remember, early detection and proactive management can significantly improve the lives of individuals living with Parkinson's and their families. Support groups and online communities provide valuable resources, information, and emotional support. Be wise staying informed, seeking timely medical care, and embracing available treatments and support systems. You can navigate the challenges of Parkinson's with resilience and hope. In conclusion, being aware of the early signs of Parkinson's disease is a powerful tool. While the journey with Parkinson's can be challenging, early detection empowers individuals to take control, access timely treatment, and improve their quality of life. Remember, these signs are not definitive diagnoses, but rather indicators that warrant further investigation. Be wise staying informed, being proactive about your health, and seeking support when needed. you can navigate this journey with greater confidence and resilience. The advancements in research offer hope for better treatments and, one day, a cure. Let's continue to raise awareness, support those affected by Parkinson's, and advocate for continued research efforts. Together, we can make a difference in the lives of individuals living with this disease and their families, fostering a future filled with hope and improved well-being.